Hello friends, welcome back. In this session we are going to discuss about radiological age estimation from the wrist joint, the part 3. Please visit the part 1 and part 2 videos about age estimation from the shoulder and the elbow joint. Myself Dr. M. Srinivasan from Chettinad Hospital and Research Institute, Chennai. The wrist X-ray is given multiple ossification centers we have to look for, one for lower end of radius and one for lower end of ulna. Then there are 8 carpal bones you have to study in the first year, and the base of first metacarpal, and the heads of second, third, fourth and fifth metacarpals. Coming to wrist joint, if you take a lower end of radius that appears by 2 years, then fusion at 18 to 19 years. Whereas lower end of ulna, 5 to 6 years is the appearance, fusion 17 to 18 years. In the first part we have discussed while remembering the fusion age for the wrist joint, that is starting with 17 to 18 years, with some exception I told, that is for lower end of ulna only. For radius lower end you have to add 1 year from that range, that is instead of 17 to 18 it is 18 to 19 years. That is the exception we have dealt in that first part video. In this we can remember these ages as by writing the English letter N in capital, that is starting with the lower end of radius 2 years appearance, then going to head of the radius 5 years, then coming down to lower end of ulna 5 to 6 years, then moving upwards ending with the tip of olecranon passes, that is 9 years. Already told in the part 2, tip of olecranon is 9 letters, 9 years we can remember that appearance. The lower end of radius can be remembered by writing the capital R, where you can write this like this, right? The R that represents 2 here in the red letter, that is for 2 years is the appearance for lower end of radius. As far as ulna lower end appearance, if you write a letter U and extend like a 6, that is appearance 5 to 6 years. Now coming to carpal bones, there are 8 carpal bones in number that can be remembered by the mnemonic "she looks too pretty, try to catch her," you may be knowing. And among the 8 carpal bones, capitate is the first one to appear. I would like to tell here, anything that starts with the C is the first one to appear. In the scapula, that is a coracoid, appear earlier than the acromion. In the elbow, capitulum is the first one to appear at 1 year. Here, carpal bones also capitate 2 months after birth. Then hamate, 3 months after birth. Then tracheal, 3 years. Lunate, 4 years. Scaphoid, 5 to 6 years. Trapezium and trapezoid, all 5 to 6 years. And pisiform, 10 to 12 years. In this, to remember, generally as the normal rule of ossification, the center which is bigger in size that appears early than the one which is smaller in size. For example, in the upper end of humerus, head appears early by 1 year, whereas lesser tuberosity which is smaller appears late by 5 years. Here also capitate is the largest bone, so it appears early compared to other bones, that is by 2 months. All the centers are by primary ossification center, right? But in the first part I told generally primary ossification centers appear in the intrauterine life. This is an exception. All the carpal bones, they are found by the primary ossification centers, but they appear after birth. This is an exception to the general rule. So capitate 2 months followed by hamate 3 months. Tracheal can be remembered by tri for 3 years. Lunate can be remembered by L. If you make extend, like you can write like a 4 like that, 4 years. Scaphoid, S can be written like a 5, so 5 to 6 years. Trapezium, trapezoid also same, 5 to 6 years. Multiply 5 to 6 by 2, that is 10 to 12 years is for pisiform, that is the last bone to appear. As far as order of appearance, we can remember the mnemonic clocks have 12 letters, sometimes 2 to 3 pendulums, or come home too late so that take punishment. Here C for capitate, H for hamate, T for tracheal, L for lunate, S for scaphoid, then 2 T's for trapezium trapezoid, P for pisiform here as the ascending order, starting from the capitate and ending with the pisiform So this is the cross structure of these carpal bones, where they are locating. Say underneath the lower end of radius is the scaphoid. From the radius to ulnar side, that can be remembered by the mnemonic as I told. She looks too pretty. You can write in the proximal row, that is a SLTP. Then above that the distal row, try to catch here, right? TTCH, right? That is scaphoid, lunate, tracheal, pisiform. Pisiform is seen below the medial part of lower end of ulna. More medially you have to look for. More medially below the ulna you have to look for pisiform bone. Then as far as this distal row is concerned, again from radial to ulnar side, that is from thumb to little finger side, you can write with the pen, that is trapezium, right, which is below the base of the first metacarpal. Then trapezoid, that is below the second metacarpal. Then this one capitate, that is a bigger one, bone below the third. Then hamate below the fourth and base of fourth and fifth metacarpals. You can find these things. So this way you can remember the where they are organized here in the wrist to easily find out in the X-ray. So this mnemonic is very important. Capitate, hamate, tracheal, leave the pisiform. Somehow we can remember by either clockwise or anti-clockwise also. Here I am showing this clockwise pattern. Capitate 2 months, hamate 3 months, tracheal, try for 3, that can be remembered 3 years, lunate L for 4, scaphoid S for 5. Then comes the trapezium, trapezoid all 5 to 6 years, scaphoid also 5 to 6. Then multiply by 2, that is the last one, pisiform, that is 10 to 12 years. So excluding pisiform, starting from capitate, hamate, tracheal, lunate, scaphoid, trapezium, trapezoid, we can make a circle like that. So when the X-ray is given, we can find out these carpal bones now easily. That is, the distal row is a trapezium and the trapezoid will be seen overlapping with each other as a single bone. We have to be careful. But the trapezium below the base of first metacarpal, trapezoid below the base of second metacarpal, we can find out. In the proximal row, tracheotrum and pisiform will be seen overlapping, but this pisiform is seen more medially, an oval shaped shadow superimposing on the somehow rectangular shadow of tracheotrum. Okay, so pisiform appeared or not below the ulna, more medially a circular hyperdense shadow we have to look for. Now moving on to other ossification center, that is base of first metacarpal. This is the base of first metacarpal that appears at 2 to 3 years, whereas heads of second, third, fourth and fifth metacarpals, they appear 1.5 to 2.5 years, right? That is some 6 months earlier than this. As far as fusion is concerned, base of first metacarpal fuses yearly, 15 to 17 years, whereas these four will fuse at 16 to 18 years. General rule is the center generally which appears early fuses last and which appears late fuses first, right? Here heads of second and second to fifth appears early, right? So they fuses last, that is 16 to 18 years, whereas the base of the first metacarpal which appears late comparatively by 6 months, that is 2 to 3 years. Since they appear late, they fuses early compared to heads of metacarpals, that is 15 to 17 years, 1 year in advance, right? This way we can remember 2 to 3, 15 to 17, 1.5 to 2.5, but they fuse late 16 to 18 years. That is the general rule. So 2 to 3 years base of metacarpal, 1.5 to 2.5 is the heads of 4 metacarpals. So what is the age here? Look for starting with the lower end of radius, ulna, then carpal bones, base of first metacarpal, heads of second, third, fourth and fifth metacarpals. So make a big tabular column showing all the ossification centers, their appearance, then their fusion, then find out the age as described in the part 1. Here no carpal bones are visible, lower end of radius, ulna also not visible. So what is the age in that X-ray? What is the first bone to appear? Carpal bone to appear. That is the capitate. Capitate itself not formed. So age is less than 2 months. In this X-ray, as you pointed by the white arrow, here it is the only one carpal bone, that is the capitate, is visible below the base of third metacarpal, that is the capitate. 2 months. Hamate is not visible, right? Left to that there is no hamate. So it is less than 3 months. So age is more than 2 months, less than 3 months, or 2 to 3 months we can say the age. That is after birth. In this X-ray, now 2 carpal bones are there. Generally, as a common rule, the first year there are 2 carpal bones. 2 carpal bones are there, age is 1 year. From 2 to 6 years, number of carpal bones represent the age of the child. For example, 3 carpal bones are there, age is 3 years. 4 carpal bones 4 years, 5, like that. So 2 to 6 years, number of carpal bones represent the age of the child in years. The first year there are 2 carpal bones are present. 2 carpal bones alone, age is less than 1 year, I can say. So capitate, hamate, both are there, right? From radial to ulnar side, try to catch here, right? So capitate below the third one, below the fourth and fifth middle, it is a hamate is there. So age is more than 3 months. But what is the next thing to occur here? After this hamate, what is the next event we have to expect here? It is not tracheal, it is 3 years. Prior to that, anything happened? That is lower end of radius is not visible here. So age is less than 2 years here. So more than 3 months, less than 2 years. Heads of metacarpals also not appeared, right? Less than 2.5 years. So we can say age is more than 3 months, less than 2 years. So in this X-ray, carpal bones 2 are present, that is capitate, hamate, that we have seen. Then heads of 2nd to 5th metacarpal not appeared, so age is less than 2.5 years. But head of this lower end of radius appeared, right? Lower end of radius appeared more than 2 years. What is the next event followed by that? That is a head of second, that is age is less than 2.5 years, more than 2 years. Why more than 2 years? Because lower end of radius appeared 2 years. Heads of 2nd, 3rd, 4th and 5th metacarpals not appeared. Age is less than 2.5 years. So 2 to 2.5 years is the age here in this. Tracheal also not seen, less than 3 years. Base of first metacarpal not seen, less than 3 years other than this. So base of first metacarpal not appeared. In this X-ray, 2 carpal bones, lower end of radius is well developed, formed, but heads of 2nd, 3rd, 4th and 5th metacarpals has formed. No carpal bones except these 2 are there. So as far as this concerned, these heads more than 1.5 years they appeared, right? At the base of the first metacarpal is not seen, less than 3 years. Lower end of radius appeared more than 2 years. Base of first metacarpal not appeared more than less than 3 years. So what is the age? More than 2 years, because radial head has appeared. This is more than 1.5, more than 2. Base of the first metacarpal not appeared, so less than 3 years. Similarly, the ulnar side, tracheal are not seen, less than 3 years. So less than 3 years, because base of first metacarpal and the lower end of ulna not appeared. More than 2 years, lower end of radius has appeared. So 2 to 3 years is the age here. Anyway, make the table and find the age yourself. Again, you try to derive the age yourself. Here again 2 carpal bones, capitate, hamate. Base of first metacarpal appeared more than 1.5 years. But here you see lower end of radius and the base of the first metacarpal also appeared. So age is more than 2 years as lower radial end and base of first metacarpal form. Tracheal not seen, less than 3 years, right? So next event is the tracheatal, not seen here in the below the ulna, it is not there. So base heads of metacarpals have formed, right? So age is already told 2 to 3 years, right? In this X-ray, here 1, 2, 3 carpal bones are there. Tracheatum also formed. Capitate, hamate, tracheatum, lower radial head has formed, right? Base of the first metacarpal is seen here. Heads of second metacarpal, so above 2 years, above 3 years, but a lunate has not formed here, right? So lunate is not. She looks too pretty, right? So adjacent to this tracheatum lunate bone is there, it is not there. It appears at 4 years. So age is between 3 to 4 years, we can see. In this X-ray, you can see that is a plain X-ray of the left wrist joint AP view. We can see what are the carpal bones. So capitate, hamate, tracheatal. The arrow represents the lunate also formed here, which appears at 4th year. But scaphoid, trapezium, trapezide not seen, which appears at 5 to 6 years. So age is above 4, less than 6 years. Similarly, lower end of ulna also not appeared, 5 to 6 years. Here the lower end is not seen, so less than 6 years. So age is above 4, less than 6. In this X-ray, we can see there are 5 carpal bones. So 1, 2, 3, 4, that is capitate, hamate, tracheatal, lunate. What is this carpal bone? This is the trapezide. Trapezium will be here. Trapezoid is seen here. So age is above 5 years, right? But lower end of ulna not appeared. Scaphoid, trapezium not appeared. So less than 6 years. So 5 to 6 years should be the age here. This is the, what is the bone here? Tracheatum, lunate, trapezoid. In this X-ray, again 5 carpal bones are there. Lower end of ulna not appeared. But this carpal bone, what it is? It is the trapezium, right? It should be trapezium, but trapezoid not formed here. Anyway, 5 carpal bones are there. Again, same age, above 5, less than 6, because trapezoid and lower end of ulna, scaphoid not found. In this X-ray of plain X-ray, wrist joint AP view, here lower end of ulna not found, but the 6 carpal bones are there, right? Both the trapezium, trapezoid are there. So age is, but scaphoid not found in the left side. So age is 5 to same 5 to 6 years, because scaphoid not appeared. In this, scaphoid is appeared. This is the scaphoid, trapezium, trapezoid, capitate, hamate, tracheatal, lunate. So scaphoid also appeared above 5 years, but the lower end of ulna not appeared, 6 years. So 5 to 6 years should be the age here, right? So all the 3 carpal bones, okay, trapezium, trapezoid and scaphoid are there. Moving on to this X-ray, you can see how many carpal bones? 1, 2, 3, 4, 5, 6, 7, right? So trapezium, trapezoid are seen overlapping with each other, but only 7, except pisiform. All the 7 carpal bones are here. Pisiform has to look medially below the lower end of ulna, more medially overlapping the tracheatal shadow. Here it is not there. So age is above 5 years. Base of the first metacarp appeared not fused. Heads of second, third, fourth and fifth metacarpals have appeared not fused. Right? So what is the age? Age is above 5 years. Below 12 years. Because pisiform not formed. So lower end of ulna appeared. This is the, what is this bone? This is the tracheatum only seen, pisiform not seen there. So in this X-ray, there are all the carpal bones present, right, including pisiform. This is the pisiform shadow overlapping the tracheatum shadow, right? This is a pisiform, a circular shadow, hyperdense shadow overlapping the tracheatum. So it has appeared. Age is above 10 years. Lower end of ulna appeared above 5 years. Pisiform appeared above 10 years. But we saw the first metacarpal, we saw first metacarpal appeared not fused. So age is less than 17 years. As fusion occurs at 15 to 17 years. So age is about 10 years because pisiform has appeared. In this X-ray also you can see a circular shadow. Pisiform has formed less than more than 10 years. Lower end of this base of the first metacarpal appeared not fused, less than 17 years. 10 to 17 years should be the age. This X-ray, plain X-ray of wrist joint left and right side. This the left side you can see the lower end of ulna appeared not fused. Lower end of radius also appeared not fused, right? Here you can see typically a circular shadow overlapping the uh, tracheotomy. This is the pisiform. Pisiform as a circular more medially below the ulna. You can easily make out a hyperdense shadow, right? That is a pisiform. 10 years appear 10 to 12 appeared more than 10. Base of the first metacarpal also appeared and fused here. So age is above 15 years. As far as heads of all the metacarpals that also appeared and fused here, right? Everything seems to be fused. So above 15 years for base of metacarpal, this fusion above 16 years, but the lower end of ulna not fused, that is 17 to 18 years, less than 18 years, right? So more than 16 years, less than 18 years should be the age. Lower end of radius fuses late, that is 18 to 19 years. So narrowest range should be above 16 years because these heads have fused. Not below 18 years, lower end of ulna not fused. So heads of second, third, and fourth, fifth metacarpals, ulna not fused. Lower end of radius not fused. In this X-ray, you can see there are all the carpal bones. This is the pisiform. This is the circular shadow. Base of first metacarpal fused. Heads of 2, 3, 4, 5 all fused. Lower end of radius also fused. Lower end of ulna fused. So among the fusion, radius is the last one to fuse. That is above, that is 18 to 19 years. So age should be above 18 years. He could be 20 years, 30 years, but above 18 years should be the age. This is the pisiform or medially below the ulna, a circular shadow you have to look for. Sometimes confusion may arise like this, where we can see the three carpal bones including the tracheotomy, but a base of the first metacarpal has not appeared. So in this situation we have to rely on the other joints X-ray to arrive at the age, or there may be some chromosomal abnormalities like that. In this X-ray again 4 carpal bones are there, right? That is a capitate, hamate, lunate, tracheotomy, all are there, but base of the first metacarpal, heads of second, which should have appeared early, all these have not formed. Heads of 4 metacarpals, all these have not formed. So there may be some chromosomal abnormality may be there. Here in the trisomy 18 child, 3.5 years old female, showing differential carpal delay. See, base of first metacarpal and second, third, fourth, and fifth heads of metacarpals have formed, but none of these capitate hamate have appeared, which should have appeared earlier than this. So there may be a differential carpal delay. So we have to keep these things also in mind while determining the age. If there is abnormality, then you have to do chromosomal assay and all. So with this, we have come to the end of this discussion. Thank you very much for patient listening. Then watch the other parts, especially involving the ossification of lower limb joints in the next part. Please watch that. Thank you.